Professor Angus Dalgliesh on the line, Foundation Chair in Oncology at the University of London since 1992, now Emeritus, Principal of the Institute for Cancer Vaccines and Immunotherapy, trained in general medicine in Australia and have served as a consultant virologist and immunologist in addition to oncology, did research degree and focused on the role of HIV and how it caused AIDS, discovered the CD4 as its principal receptor and how the virus causes disease by mimicking foreign HLA antigens. He was convinced that no HIV vaccine based on the envelope would work, but had all his applications based on the alternative selective conserved antigens turned down. In collaboration with Birger Sorensen, if I'm pronouncing it the right way, of Norway, he had developed a vaccine that actually works, but has been actively ignored by the Fauci and the Gates of Foundation. To date, his greatest impact has been the resurrection of thalidomide as an anti-autoimmune and cancer agent. This led to a 2-decade-long collaboration with Celgene, which led to the development of lenalidomide and pomalidomide, which have revolutionized the treatment of myeloma and lymphoma. Professor Angus Dalgliesh, welcome to our show.
Thank you very much.
How are you doing?
Okay, I have a little bit of a throat today, but I think it's due to being exposed to air conditioning and fans everywhere because it's been very hot.
Yes. The reason why I read out loud this amazing bio is because we never wanted to give the impression that we are anti-medication, that we are anti-vaccination. Medicine is amazing, but transparency is very, very important. I would like to delve deep today into turbo cancers. A lot of people are speaking about it. Some medical professionals are saying that this is a myth and turbo cancer doesn't exist. Your views about this?
Well, my views are very simple. It is that we are seeing cancers presenting at a later stage in younger people and which do not respond well to standard treatment. And that in trying to work out why this is, the only thing they've had in common is that these patients have usually been exposed to a booster COVID vaccine, messenger RNA vaccine, or even worse, the 4th or the 5th vaccine. And I think the link is absolute. I have many colleagues who completely agree with this. They are told to be quiet when they mention it to hospital directors. I had one colleague who was alarmed that she'd seen, instead of 1 or 2 cancers of the cervix present a year, she found that she had about 11. And these patients had all been vaccinated with HPV vaccine, the cervical cancer vaccine. And yet, after being given the COVID vaccine, that they exploded with cancer of the cervix. She pointed this out as this is an urgent emergency, and the medical director suspended her, saying that she clearly needed a psychiatrist. This is the type of nothing to see here that's going on, which is just truly dreadful. And anyhow, I don't take anything at face value, and I get special secondary referrals, and I'll just give an example. In one afternoon, I saw 6 patients, which I rarely do see that many, but I'd been away in Australia for a month. And what was staggering, they all had turbo cancers. They all had started treatment. They'd all presented stage 4. They're all aggressive. And the only thing they had in common was they'd all had a vaccine booster. I was probably the nth doctor to have seen these people. They'd been to their GP several times. They'd been referred for investigations to surgeon, to their oncologist. They were on chemotherapy. I was the only doctor that asked them their vaccine history. Now, when I was taught to be a physician, you took all the history. You took family history. a recent history, past history, everything, to see whether it shows light on the diagnosis and the management. So this is exactly what is going on. The doctors are not asking, and therefore they're saying this is what they say, there's no evidence that these cancers are associated with the vaccine. Well, the reason is they don't ask, and they're deliberately not asking about it.